Gentlelady yields. The chair recognizes himself for 5 minutes. How about that? Thank y'all for being here. I appreciate it very much. I'm very proud to say that the CDC is located in my home state of Georgia, and we're very proud of the work that you do. However, I do have some what I consider serious questions here. The Communicable Disease Center, of which it was formerly known, was the main function, as I understand it, was to predict and protect Americans from infectious disease threats. But it's over time evolved into much more than that. The core mission has been diluted by bureaucracy that's covering now everything from environmental justice to deforestation, firearm deaths, social detriments of health, and a lot more. For example, Mr. Daskalasis, the National Immunization Survey, the CDC is using taxpayers' dollars to call Americans over the phone, asking them for medical information about their vaccination status. In fact, several of my constituents have called me and asked me about this. They've recently received phone calls from the CDC asking them whether they had certain vaccinations or not, such as the COVID vaccine. I understand the importance, trust me, of making sure you got the information that you need. I get it. But at the same time, it's critical for these agencies to respect the freedoms and the privacy of the Americans. So the first question I've got, Dr. Daskalaskis, how do you get these phone numbers? Where do you get them from?
Thank you so much for that question. So I think I cannot actually comment on the algorithm that's used to sort of identify the phone numbers, but the National Immunization Survey, as you've mentioned, is really important in us understanding what coverage is for vaccinations so we can identify what parts of the country and in what populations we need to do more work. Part of the work at CDC—
I understand. My question is, where do you get the phone numbers from? And you say you don't know?
We'll have to get back to you.
I was about to say, please get that information to me, okay? Thank you. How many people has the CDC contacted? Do you know, under the National Immunization Survey?
I don't have the numbers of how many people we've contacted, but we can get that. We can get back.
Please do. And do you happen to know how many surveyors that the CDC employs?
Again, we'll have to get back to you on those specifics.
Okay, sure do need to know this information. Does the CDC collect information on children's vaccinations?
The CDC has several systems to monitor vaccination in the U.S. One of them that you've already mentioned is the National Immunization Survey, and
right.
Included in that is a survey that happens to parents specifically to learn more about childhood vaccines. Additionally, our immunization information—
So, do they contact children?
The CDC, those surveys are actually for the parents.
So they contact the parents of the children.
Correct. And we also have immunization information systems that really focus on getting vaccination coverage information for parents and from children. Ends up being really critical in terms of the information that children have with their care providers, as well as for their schools.
You know, and again, can you get me the information about where the phone numbers for the parents of the children come from?
We will follow up.
Thank you. I appreciate that. Look, as I've said before, for better or worse, CDC recommendations and guidance, they carry a lot of weight. They really, and I'll say that as a healthcare professional, they do carry a lot of weight, and they are very important. So what is the collected information from the National Information Survey used for, and where is this collected information stored?
The National Immunization Survey data is used to report coverage for vaccination in the country. So as an example, during our respiratory virus season, we really brought all of this together in our respiratory vaccine view that shows what coverage is for vaccines such as COVID-19, RSV, all of the seasonal vaccines, but it's also the information that we use to identify coverage for routine childhood vaccinations such as measles, mumps, rubella, and all of the other vaccines that are recommended. The information is de-identified. So we actually don't track down to an individual, but only track sort of population trends that we see.
And where do you store it?
Our information is stored at CDC, but again, it is de-identified information.
Okay, so you feel like you're in compliance with HIPAA, so there's no problems there?
Since the information is not identified, we don't have the information that includes identifiers that would require us to have any sort of sort of HIPAA.
Look, I have a fiscal responsibility to the taxpayers as a member of Congress, as we all do. Do you feel like this is a good use of taxpayers' money?
Understanding vaccine coverage is critical for us to be able to better advise healthcare providers and physicians and others in terms of populations that they need to focus on. Being able to see where we have decreases in measles, mumps, rubella outbreak really allows us to use strategies to accelerate catch-up vaccination. We know because of the increase in measles, mumps, or measles outbreaks in the U.S. that populations with lower coverage are the ones that are the most susceptible. So that information is critical for us to really maintain the health of children as well as adults.
Fair enough. Please do follow up with those answers to those questions. Thank you.
Thank you.
And I'll yield